AAC, which stands for Augmentative and Alternative Communication, is basically a term for a lot of different techniques that we can use to help people communicate if they can't actually use their own speech to do so. Lots of people can benefit from AAC across the lifespan. Some children are born with a different ability to communicate, and they do not develop speech as typically developing children would. So speech pathologists can step in from a very early point to start to introduce symbol-based communication systems. A lot of the people that I treat have suffered some sort of brain injury, or they have a progressive neurologic disorder that impacts their ability to speak. So we are able to utilize different types of communication to help them continue to communicate with their family and friends. There are many different types of AAC that fall into two basic categories. One is unaided and one is aided. Unaided stands for anything that you can do with just using your body, so any facial expressions or gestures that you use to communicate. Now, aided systems can be a little more complicated. They can also be simple though. An aided system could be something as simple as writing a message on a piece of paper, all the way up to speech-generating devices that run on certain software that you can access through your eyes. Eye gaze technology has really come a long way in the last 5 to 10 years, to the point now where it's pretty easy to use. It allows us to give patients who are living in silence, who can't use their arms, their legs, and can't speak, it allows us to give them the ability to reach out and talk to people and tell their loved ones how much they care, and tell people when they're in pain. Communication is something that a lot of people take for granted, and people who are going through some neurologic impairment, brain injury, that lose the ability to speak are really noticing what it does to their quality of life. It can be very alienating and lonely when you aren't able to communicate. We work really hard to rehabilitate a client's ability to speak. But if we aren't able to do that, augmentative communication allows us to give them a different outlet to be able to communicate their wants and needs to their family, their loved ones, and also their healthcare providers. As long as we have a patient who is motivated to communicate and they have the physical ability to at least move their eyes, then we can help them communicate and we can help them improve their quality of life.